Welcome and thank you for watching the slideshow on common skin problems in infants. In the 10-minute presentation, you can learn from an experienced nurse, Mary, from the Maternal and Child Health Center about the care of some commonly encountered skin problems in young babies, including diaper rash, heat rash, seborrheic dermatitis, and infantile eczema. Diaper rash.
Hi, Mary. Why is Kelly's bottom so red?
Let's have a look. Ah, she's got diaper rash.
What is diaper rash?
Diaper rash appears when the baby's skin is irritated by urine and feces. It mostly occurs on areas covered by the diaper, like the genital area, buttocks, lower abdomen, and the upper part of the thighs. It starts as red spots and develops into patches of small and raised reddish rash. The redness can sometimes spread over the whole bottom.
I see. So what should I do?
Most important is to keep her buttocks clean and dry. You can change the diaper frequently and use lukewarm water and cotton wool to clean her buttocks each time. Then allow her skin to air dry fully before putting on a new diaper. A thin layer of moisturizing cream can be applied to keep the urine and feces from direct contact with the skin. Or you can apply some barrier cream like zinc oxide cream to form a protective coating on the red and raw skin. Remember not to use baby powder as it will clog the sweat pores when mixed with urine or sweat, and it may worsen the condition. Consult your doctor if there is no improvement or if the condition is severe. Heat rash.
Mary, there are lots of red spots at the back of Kelly's neck. What are they?
That's heat rash. Well, when the baby is too hot, they will sweat. The sweat then causes irritation to the skin and forms these small raised red spots. Heat rash usually occurs on the baby's neck, back, and chest, especially in hot weather. However, it may appear even in cool weather if Kelly is wrapped in excessive clothing.
Then what should I do?
Don't worry. Simply clean the sweaty skin with water. Dress her in appropriate clothing to keep her skin cool to reduce sweating. The heat rash will then disappear quickly. But if there is no improvement or if it gets worse, bring her to your doctor. Seborrheic dermatitis.
Mary, I wash my baby's hair every day, but there are still lots of yellow patches sticking to her hair. Is that a problem?
That's called seborrheic dermatitis, or better known as cradle cap. The exact cause is still not clear, but it usually appears when the baby is around 3 weeks to 3 months old. In most cases, it will fade gradually at around 6 months of age. The baby's skin appears slightly red, with lumps of small oily flakes or yellowish thick scales adhering to her scalp and eyebrows, forming a layer of scab.
Can it occur in other parts of the body?
Yes, it can. But it usually occurs in areas rich in skin glands, like the scalp, forehead, cheeks, eyebrows, ears, armpits, abdomen, and folds between the thighs.
The scales are quite thick, and Kelly doesn't look very comfortable. What can I do?
Well, first of all, you can clean her skin with water. There is no need to use soap. Then apply moisturizing cream every time after cleaning to keep the skin moist. For thick scales on her scalp, you can apply olive oil onto the scalp, and then leave it on for about 20 minutes to soften the scales. Then wipe them off gently with cotton swabs. After that, shampoo her hair and use a comb to clear away the patches adhered to the hair. Repeat these steps if necessary. Again, if the condition is getting worse or if the scalp appears red and inflamed, consult your doctor. Infantile eczema.
Mary, Kelly's skin was fine during the first 2 months, but recently her face appears quite red and rough. What's happened?
Let's have a look. Oh, It is eczema, what we call infantile eczema. Infantile eczema usually occurs when the baby is around 2 to 3 months old. It usually appears on the cheeks, elbows, knees, body, and folds between the thighs. But the affected areas may vary as your child gets older. At around 2 years old, the neck and the back of the knees and elbows are more likely to be affected. The skin appears red and dry. Small blisters may appear sometimes, and scabs are formed when the blisters break. The affected areas are extremely itchy, and the skin becomes thick and hard after scratching.
Why does Kelly get this? Did I eat something wrong during pregnancy to trigger her skin problems?
Anna, the exact cause of infantile eczema is not known. It is believed, however, to be related to some genetic factors, but it is not infectious. It's common that other family members may have allergies to certain substances, such as detergents, pollen, dust, or food. Or they may have atopic diseases like asthma or rhinitis.
Is there an ointment that I can use? And how can I prevent Kelly from getting eczema?
Well, it is important to keep her skin clean and moist. Bathe her with lukewarm water and soap-free bathing gel. Remember to clean the folded parts of the skin. Put on fragrance-free moisturizer after bathing. Keep her nails short to reduce the chance of skin injury by scratching. Put gloves on Kelly when necessary.
When will she recover?
Every baby is different, but the condition does seem to come and go. Most skin changes appear before the age of 5 and fade away after 15. For some children, it may persist into adulthood. Good skin care is important, and your doctor will give you medication when necessary.
Apart from that, what else can I do?
Wipe her sweat off in hot weather to avoid irritation. Apply fragrance-free moisturizer in dry weather. Choose cotton clothing, especially when it's in direct contact with her skin. For clothing made from wool, silk, or nylon, make sure it is worn on top of the cotton ones. The caregiver should pay attention to the clothing material that is in direct contact with her skin to avoid irritation. The temperature and humidity of the environment is also important. Avoid exposing Kelly to cold wind and strong sunlight. Use a damp cloth or a vacuum cleaner to remove dust at home instead of sweeping. It is best not to keep furry pets, such as cats, dogs, or birds.
What about washing her clothes?
You can use gentle laundry detergent to wash her clothes, but remember to rinse them thoroughly afterwards.
Is it food-related? Do I need to change her formula?
The relation between infantile eczema and food is not firmly established. However, breastfeeding may prevent eczema in some children. Seek advice from your doctor first before you consider to switch to a special milk formula.
Oh, I see. Thank you very much.
You're welcome. Should you have any other inquiries, please feel free to speak with our medical and nursing staff here at the Maternal and Child Health Center.